The following module discusses the levels and trends of infant mortality in India, in the states of India, and also the global levels and trends of infant mortality in developed and in developing countries. The importance of studying infant mortality gains more importance as mortality during the first years of life is very high. The infant mortality rates can be calculated by calculating data for different age groups. However, it has been seen that the infant mortality rate for developing countries are less reliable than the crude death rates because of issues such as underreporting and less registration than adult deaths. As discussed in the previous module on infant mortality, it is one of the sensitive indicators of a general level of living and also a sensitive indicator of the overall health conditions, overall life expectancy, and also life expectancy at birth when there is no availability of statistics. Trends of infant mortality in India are discussed in the module, showing an overall decline between 1980 and 2013 with varying rates and causes, varying by regions in India. Trends by sex are also depicted, showing varying trends. It has also been observed that in states where there are very low levels of infant mortality rate, further reduction would be difficult without revolutionary new medical discoveries or improvements in social and environmental public health conditions. While those states where infant mortality rate is still high, measures can be taken such as improvement in sanitation, personal hygiene, health education, public health measures, etc., especially during the post-neonatal period, and also through improved care during these periods and increased institutional deliveries. Trends in global infant mortality rates are also discussed in the module, varying by developed and developing countries, overall showing a steep decline in the world between periods 1960 and 2015, a decline of about 74%.
I am Dr. C.P. Prakasham, retired professor from International Institute for Population Sciences, Mumbai. Module 8, Levels and Trends of Infant Mortality. Learning Objectives. In this module, we will learn about levels and trends of infant mortality, trends of infant mortality in India, levels and trends of infant mortality in Indian states, global levels and trends of infant mortality, trends in infant mortality rate in developing and developed countries, importance of study of infant mortality. Estimation of infant mortality rate IMR is possible to derive if crude death rate CDR is known. Death rate by age group will give required data for calculation of infant mortality rate. However, the infant mortality rate for developing countries are less reliable than the CDR because infant deaths are more likely underreported and less registered than adult deaths. The study of IMR gains more importance because mortality during first year of life is very high than that all other ages and also high for all countries in the world. Decline in infant mortality rates has been considered as one of the most sensitive indicators of the general health level of living, also sensitive indicator of overall health conditions and indicator of overall life expectancy in case of non-availability of statistics of life expectancy at birth. Trends in infant mortality in India. Trends in infant mortality rate for the period 1980-2013 in India is given in figure 1, shows that IMR declined from 114 per 1000 live births during 1980 to 39 in 2014. There is a steep decline of IMR in India during last 5 decades. Infant mortality declined between 1980 and 1984. Further from 1985 to 2000, there is 27 points decline in IMR in India. However, from 2000 to 2014, again 29 points decline has been observed. The total period of 33 years can be divided into 3 segments, namely 1980-1984, 1985-1999 and 2000-2014. Decline in infant mortality rate can be observed. This decline in IMR can be attributed to control of communicable diseases, development of socio-economic conditions of the community, and implementation of health programs in India during specified segments. From the figure 1, it was evident that infant mortality total declined from 114 in 1980 to 42 during 2013. It was observed a linear decline with 2.073 points decline per year. However, there is some fluctuations during 1988 to 1998. During this period, IMR declined more than average and slightly increased in IMR observed in 2006-08. Trends by sex. Sex-wise infant mortality rate shows figure 2 that female infant mortality rate is higher than male during 1980-1987, fluctuating between 1988 and 1989. Later, male infant mortality was slightly higher than female up to 1991. Further, female infant mortality rate found to be higher than male by around 3 points in the recent period 2014. From the figure 2, IMR decline has been observed in male and female in India during the period 1980 to 2013. The decline in male was 2.12 points per year, whereas in female it was 2.01. However, some fluctuations were observed during 1988 to 1998. IMR for female was slightly higher than male in Indian situation. The contribution of infant mortality rate will also give the trend in infant deaths during a given period. Examining the sample registration system SRS data reveals that during 1991, infant deaths comprise 24% out of total deaths. This percentage remains above 20 up to 2001 and later percentage contribution of infant deaths to total deaths declined to 12% during 2013. Percentage of infant deaths out of total deaths reveals that during 1991 it was 24.1%, declined to 12% in 2013. It clearly shows that there is a substantial decline in infant mortality during recent period. To achieve further decline in IMR, it is required to examine the decline in neonatal and post-neonatal mortality statistics in India. Levels and trends of infant mortality in the Indian states. Though infant mortality rate declined overall, There are variations in levels and patterns of decline in infant mortality rates in the major and small states in India. Table 1 gives infant mortality rate by state during 2004-2012. During the year 2004, infant mortality rate found to be more than the India IMR 58. Among the states, Madhya Pradesh 79, Odisha 77, Uttar Pradesh 72, Rajasthan 67, Assam 66, Bihar 61, Haryana 61, Chhattisgarh 60 and Andhra Pradesh 58. Among the bigger states, Punjab 45, Uttarakhand 42, Tamil Nadu 41, West Bengal 40 and Kerala 12 showed IMR less than India IMR. These states have achieved decline in IMR prior to 2004. Smaller states and union territories IMR is less than Indian IMR. To know the levels of IMR between 2004 and 2012, the states have been ranked from highest to lowest value of IMR. It has been observed the 5 states IMR rank remained same. Clearly indicates there is no improvement in IMR and it is indirect evidence that health status remains same as that of 2004, Table 2. A rank of IMR since during 2004-2012, Madhya Pradesh 1 and 1, Andhra Pradesh 9 and 9, Gujarat 10 and 10, Chandigarh 1919, Kerala 2020. IMR declined in 5 states, namely Assam, Chhattisgarh, Uttarakhand, West Bengal and Maharashtra. Among these states, 2 states, Assam, Chhattisgarh, shows 2 rank decline and other with 1 rank decline observed, Table 3. In 9 states, IMR increased when compared to 2004 during 2012. Among these 9 states, in Punjab and Tamil Nadu, which are progressive states, IMR increased 2 rank status when compared to other 7 states in that category, Table 4. Examining the levels of IMR during 2004-2012, the level of IMR in Madhya Pradesh, Odisha, Assam, Uttar Pradesh, Rajasthan and Chhattisgarh remains same and declining trend in IMR has been observed among these states. To observe the trend during 2004-2012, percentage decline in IMR during this period has been calculated and given in table number 5. It has been observed, table 5, that among the bigger states, Uttar Pradesh 73.6, Rajasthan 73.1, Gujarat 71.7, Madhya Pradesh 70.9 and Bihar 70.5 achieved above 70% decline in IMR. States like Tamil Nadu, Punjab have already achieved below IMR during 2004, could not show more than 60% decline in IMR. Kerala state has already reached low level of IMR and depicted no further decline in IMR. The above observations on the levels and trends of IMR during past decade indicates that in states with a very low level of IMR, a further reduction will be difficult without revolutionary new medical discoveries, improve in social and environmental public health conditions. The states where percent decline in IMR is still high, there is need for reducing IMR during post-neonatal period through improvement in sanitation, personal hygiene, health education and public health measures. Reduction of neonatal mortality may also require thorough increase in institutional birth deliveries and improved antenatal obstetric care. Global levels and trends of infant mortality. Global infant mortality rate in the past was very high value according to developed and developing countries. Global world trend of infant mortality and for some selected regions in the world during 1960-2015 are listed in table 6. Shows that there is a steep decline in global IMR during 1960-2015 from 121.9 to 31. The IMR declined 74% over this 5-decade period. There is a 50% decline during 1960-1990 and steady decline during 1990-2015 in the world. All developed and developing countries divided into regions. Table 6. There is a steep decline in North America and Central Europe countries in IMR reached lowest level 5.6 IMR per 1000 live births. This reveals that in East Asia and Pacific countries, development could play limited role in declining IMR. Infant mortality rates are high in South Asia and African countries in the world. However, during this half-century period, 1960-2015, decline in IMR is much faster from 168 to 41.9 when compared to developed region in the world. During first 30 years period, 1960-1990, decline in IMR was relatively slow than the later period. However, the decline in IMR in South Asia is higher than global IMR in the recent period 2015. In Central Africa, Sub-Sahara Africa, excluding high-income regions, IMR is high during 1960 and showed marginal decline during 2015. Even during the recent period 2015, IMR is very high in Central African countries 91.0, requires special efforts to bring down IMR among these countries. From the table 6, it was evident that countries in North America region, Central Europe region and Europe and Central Asian region, further decline in IMR may not possible as IMR reached lowest level. Further decline in IMR is possible with special efforts to be made to bring down neonatal deaths to achieve decline in IMR at global level. However, countries in Asia with IMR between 66-28 per 1000 live births such as India, Pakistan, Afghanistan and African countries such as Nigeria, Zimbabwe, Ethiopia have better opportunities of reducing IMR through special efforts in controlling the environmental factors. Australia, which is one of the developed countries, achieved lowest IMR in the recent period 2015, joining with top 10 countries and further reduction possible, reducing incidence of exogenous mortality. During 2015, infant mortality was high in Sierra Leone 107 and Lesotho 73 among 10 highest IMR countries in the world. Other 10 countries where IMR was least 2% per 1000 live births was Japan, Singapore, Finland or the developed countries. Table 7. Questions. Discuss the trends in infant mortality in India during 1980-2013. Discuss the variation in levels and trends in infant mortality in Indian states. Discuss the global trends in IMR during past decade. References are important for this module to look into.
इस क्षेत्र में अपने प्रयासों को और तेज करने के लिए सरकार ने 12वीं पंचवर्षीय योजना में 5 साल से कम उम्र के बच्चों की मृत्यु दर का लक्ष्य प्रति 1000 पर 33 रखा है।
2009 में हमारा जो एनुअल रेट ऑफ डिक्लाइन था वो 7.2% था, 10 में पहुंच गया ये 7.8%, जो अपने आप में एक रिकॉर्ड है। लेकिन बहुत ज़रूरी ये है कि हमें इस गति को अब मेंटेन करना है। तो हम लोग स्टेट्स के साथ शेयर कर रहे हैं कि हर वर्ष उन्हें 7.5% डिक्लाइन को कम से कम ज़रूर मेंटेन करना है, ताकि हम इसी गति को हमने धीमा नहीं होने देना है, बना के रखना है।
Alors la mère, c'est ma patiente depuis la grossesse, depuis même avant la grossesse. Je parlais de la mère avant la grossesse, de la planning familiale, des IST, des MST. Maintenant, elle devient enceinte. Pendant la grossesse, on lui a conseillé d'aller faire des consultations prénatales. Elle a suivi toutes ces consultations prénatales. Et puis vers la 3e trimestre de grossesse, disons à 9 mois, elle a ressenti des douleurs, des migraines, des douleurs de la colonne vertébrale. Alors, moi, en tant qu'agent de santé, je vois que c'est un signe d'éclampsie. Je l'ai envoyé à l'hôpital, puis c'est ça, le médecin a dit vraiment c'est un signe d'éclampsie.
Each community worker in the program takes care of about 1,000 people. Daily, they need to visit 10 families to accomplish this goal. The director of the center reminds that with the agents, it's possible to prevent many diseases.
Es un programa que empezó hace 3 años, un programa que ha dado mucho resultado satisfactorio para la población de Carrefour. Cuando empezamos, naturalmente, empezamos con muchas dificultades. Primero, la población no tenía esa costumbre de recibir realmente atención, una atención de calidad, pero una atención al principio que fue gratuitamente, completamente.